Bone health is a major concern for patients who are about to start treatment for their prostate cancer. The most effective treatment of advanced prostate cancer initially is to reduce the serum testosterone. Traditionally, this has been done by surgical castration and more recently with chemical castration. As a matter of fact, outside of the United States, 90% of men undergo surgical castration, which is very effective in controlling their prostate cancer up front. Here in the US, for various reasons, we use much more chemical castration, but the effects are the same. One of the major side effects of reducing serum testosterone is increasing the rate of osteoporosis, increasing the rate of fractures in these patients, and overall a decrease in bone mass. This has been shown in many trials over the past decades and is well established. But on the same token, there has been a lot of research into how to prevent the osteoporosis associated with androgen deprivation, meaning lowering serum testosterone. Originally, we used to use so-called bisphosphonates that initially were supplied as tablets. Now we have more potent form of bisphosphonates that are given in IV form every 4 weeks, and they have been shown to stop or even improve the bone density in men who receive hormone therapy. The most effective possibly is called zoledronic acid, and although not FDA approved for this indication, has been used and shown to be effective in reducing bone loss in men with hormone deprivation. More recently, a more biologic drug was approved with the name of denosumab, and what this drug does, it is actually a monoclonal antibody. So it's an immune therapy that affects the bone resorbing cells in the patients. It is highly effective in slowing down and sometimes possibly also reversing the bone loss in men who receive hormone deprivation therapy, and was recently approved by the FDA for this indication. It is given once every 6 months as a subcutaneous injection. And men who are being treated for 2 to 3 years with hormone deprivation therapy should strongly discuss this option with their physicians. More straightforward measures to prevent bone loss is to make sure there is a sufficient dietary intake of calcium and daily vitamin D. I do always recommend my patients moderate exercise 4 to 5 times a week to maintain their bone health. And these are things that everybody can do in addition to the other drugs I mentioned.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.